All right, Residency Reflection Week 11. This week, another roller coaster. I feel like that's kind of been a theme throughout this whole residency. It's just every week is a roller coaster of emotions and experiences and things like that. So we started off really well. Got to see 7 patients on Monday, so that was good. That was kind of my target number for the day. Tuesday, we had an online lecture at George Washington with a guest lecture on electrodiagnostics, so that was really cool. Not something that you get to see a ton of unless it's an area that you kind of specialize in, so it was nice to be able to learn from the guest lecturer, and he had some really helpful videos and things. Wednesday, I got to see my first patient with an acute spinal cord injury. It was a gunshot wound that ended up resulting in a spinal cord injury, so that was definitely a big learning experience. So that he was, this particular patient was, I think, 3 days out from their injury, if I remember back correctly. It was with one of my mentor patients, so definitely also my first full max patient to get sitting up edge of bed. You know, most patients that I've been seeing so far can have pretty much full strength on one side and at least some strength on the other side, or they only have that hemiparesis, so they have one side that's still able to help. So it's definitely a big new experience having somebody. This particular patient has an injury somewhere around the lower cervical, higher thoracic level. He hasn't had an Asia done yet, but and it was a much more difficult transfer than I guess I was expecting, and I was expecting it to be difficult, but it was still difficult. We practice in school and things, and practicing with the students at GW, but it's so hard to mimic a true max transfer. So I'm glad I got to have my mentor there. She was able to give me some tips and some tricks and kind of things that she's learned in working with patients with spinal cord injury. And then got to see a couple patients who were diagnosed with COVID on that day. Definitely something serious. Please, 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 people, take it seriously. Wear a mask, wash your hands, social distance, all that good stuff. Definitely having some respiratory issues with those patients. And then Thursday, got to have another mentor session. Friday was our last lecture with the students at GW. So we pretty much were just going over a bunch of topics and things and helping facilitate discussions on Blackboard, and got to kind of meet with our head faculty advisor at GW and talk about how the semester went and get some feedback there. So that was really good. I was encouraged by a lot of the feedback that I got. I felt like I did a decent job, and some of this feedback that the students provided through some anonymous forms was also helpful, and it seems like they enjoyed what I was able to do and my style and stuff like that. So that was encouraging, made me feel pretty good. Definitely just a tiring week. Seeing the COVID patients, or patients diagnosed with COVID, was just tough, because it's just kind of like an affirmation again of this isn't going away. It's just sticking around until the vaccine comes or major changes are made. So that was kind of just like a little bit of blow to morale. Is just that this is going to keep coming. But at the same time, it was nice to be able to try and help those patients and hopefully make an impact on their recovery. And it was really cool to get to see the patient with a spinal cord injury, but at the same time, also just kind of that learned or conscious incompetence of never having seen a patient that was that much of an assist level that early with their injury. So a lot of learning there. And I think this roller coaster that I've been kind of expressing the past couple weeks is just, that's the learning process. Is it's hard and it's fun and it's exciting, but it's hard, and there's a lot of vulnerability that has to go into that to kind of bring it back to the book review I talked about last week with Darren Greatly and everything. And so it's just it's fun, it's hard, it's tiring, but I wouldn't trade it for anything right now. And then I got to record another episode for the podcast yesterday, so that was fun. Had a great time with that. Going to record another episode tomorrow. Hopefully start getting these edited, and then keep that bi-weekly schedule for that going. So definitely just also coming off of, the couple days off from Thanksgiving. Kind of got to lay low for a few days and didn't have to do much. And then jumping right back into everything full swing was just kind of like a energy change that for some reason hit me harder than I guess I expected it to. But week was good. Looking forward to this next week. Coming into the holiday season, hoping that we can. The physical therapy staff at the hospital, we've been really caught up getting to evals the day of or the day after the orders are put in, so we're not behind, so that's been really nice. But yeah, just keep plugging away at it. I'm switching floors. I'm rotating to a neurosurgical and neuro-only floor. So the floor I was at before was primarily a floor for patients post-stroke, but there was a lot of general medical overflow, and right now there just aren't a lot of patients post-stroke coming into the hospital for whatever reason. There's just happens to be that way. But I'm rotating to a neurosurgical floor and a neuro-only floor, so I'll get a lot more patients with neuro conditions strictly, and then I also have a general med psych floor, and my co-resident will take over the floors that I was on. So getting to rotate there, so that'll be exciting. Hopefully I'll get to see some patients that are have traumatic brain injuries or just general brain injuries, and get a lot more brain bleeds and post neurosurgical patients, obviously, as I've kind of said. So looking forward to the floor rotation, looking forward to keep going, and now that we're kind of wrapped up with stuff at GW, we have some didactic studying that we have to do for the neuroconsortium exams that we have coming up. So it'll be good to kind of go back through and review a bunch of that stuff, because it's all super clinically relevant too. So that's this week in a nutshell, and looking forward to the next one. Week 11. I can't believe it's been 11 weeks since I started in the clinic. So that's this week's Residency Reflection. Thanks for watching.